flexion and extension on a wall. So we're going to use this wall as a way to put our leg above our torso to have gravity help facilitate pushing some of that fluid out of those knee joints. Or maybe we're using this as a way to kind of get motion in the lower limb to drive fluid out of that limb in general. So if you have some sort of acute trauma, maybe you're post-surgical, when you have that fluid accumulate in your limb, getting it above your torso and then facilitating some motion in a controlled environment will help create what we call a muscle pump, where the muscles are contracting and relaxing, and it will push the fluid down the limb back into the lymphatic system. If you're somebody that you're up on your feet a lot of the day, the fluid will kind of pool to the limb. So this is a way for us to push the fluid back out. The closer you are to the wall, the harder and the more knee flexion you're going to go into. And it also takes a little bit away from the knee extension or straightening. So there is kind of a sweet spot when you're set up. How I like to do it is kind of get a foot or so away from the wall, rotate, and put both legs up on the wall. So for the video's purpose, I'm going to use my right leg. And what I'm doing is I'm going to kind of slide my foot up the wall to get my quad to fire. And I'm thinking about letting my knee get all the way straight and kind of hanging. So you can see that if I'm all the way against the wall, I'm not going to get as much of gravity pushing my knee into extension, but if I'm closer to the wall, I can really focus on getting more flexion. So if you're somebody that needs more knee bend, the closer you get to the wall, the more you can get some assistance with flexion. And then what you can do is you can kind of be playful with your positioning here and use the wall as a way to kind of create some muscle contraction. So a lot of times it's getting your brain comfortable with bending the knee again. So what I can do is I can slide down the wall, and then I can kind of push my foot into the wall and use the wall as some friction and drive my foot into the wall to get my quad to fire. And I can hold that for maybe 3 to 5 seconds, relax, and then I can use my opposite leg to kind of help assist down into more flexion. And then you'll see that my knee starts to slide forward, so the actual flexion is not changing. So that means I need to get closer to the wall. So then I would just scoot a little bit closer to the wall, and I'm in this position, coming down into knee flexion, get to where I feel a little bit of a tension, put my foot into the wall and start to slide up to get my quad to fire, almost like I'm going to do like a leg press and push myself away from the wall. If you don't feel your quad fire, you can bring the opposite leg over to help facilitate that isometric, and then I'd relax and try to pull it down a little bit further, and then I can use the opposite limb to push. So essentially we're using the wall to assist, and we're transitioning in and out of these points. So this would be called like a contract relax technique to facilitate a little bit of knee flexion. Some people will just use it as a way to get into extension, hold that position for 5-10 seconds, come down into flexion, hold that for 5-10 seconds, and you're just moving in and out of your knee being straight and your knee being bent in this position where my leg is above my torso to help drive some of that fluid out of the limb to control for swelling or effusion or anything, edema, whatever you have going on.